My name is Dr. Gina. I am here to talk to you about something I'm very passionate about. It is the plasma energy. And why I'm passionate about, I will try to transmit to you with the best of my abilities, because it's something that I think can help all of your practices, and it's something that already helped mine so much, and it can help also your patients. For that, I'm sure. I just hope that I'm able to give you how much I like it, and to make you understand that. Plasma energy is a safe and versatile technology for skin rejuvenation. There are main three reasons why I think that. The first main reason is obviously because it's easy for me, it's easy for my patient. That's, for me, is the most important thing. No harm. We should never treat someone and give harm. The first thing we should do, never give harm. The second thing, it's because this technology is a technology that, depending on how much you use it, on how much you want to go deep, depending on the energy that you use with the technique, you can have complete control on the recovery time of your patient, even on the possibility of side effects. So if my patient says to me, Gina, I have 10 days, do whatever you want. I can work strong as I want, I can go deep as I want, medically possible. And if they tell me, Gina, I came here for my lunchtime. I want result, but I have 1 hour. They have to go back to their work, and that I take extreme importance to. It's my patient's social life. So you can control that with this machine. The third reason why I think this machine and this technology is so good, and I'm very happy to be using it every day. I have been using it for now 3 years, and it's the reason that it's a very versatile machine. You can use it in the place of fractional dioxide carbon laser. You can use it in the place of electric arc curettage. You can use it even in the place of mesotherapy needles. I'm not kidding. I use it even for that. And it's something that I like so much, I take it with me on my luggage. It's small, I take it on my luggage when I travel, because I always find a reason to use it. So because of its versatility, it's something that I am very, very happy every day that I have it in my clinic. After I bought it, I was extremely happy. Okay, little movement there. Let me go back. So, what plasma? We always think of plasma. When we think of plasma, we think of the thing inside the TV that we don't understand really well. Maybe some of you do, I don't. And we think about lightning, and we think about the aurora borealis, but plasma is so much more. Plasma is actually the fourth state of matter, which is the most abundant matter in this planet. 99% of the matter in this planet is plasma. Actually, solid, liquid, and gas are much more rare than plasma. But to tell you and explain to you what plasma is, I have to talk a little bit about the other states of matter. So, an example of plasma. First, you have solid. When you get a solid object and you apply heat or energy to it, it becomes liquid. So when you get liquid and you apply energy to it or heat to it, it becomes a gas. When you have a gas and you apply energy to the gas, it becomes ionized. And that's when you have plasma. So it's heated, energy, pressured gas. And ionized means, like you are seeing here, it's when the neutron loses, the atom loses its electrons, but the electrons, they don't go anywhere. They stay together. They stay there, but it's not inside the nucleus anymore. That's plasma. And how do we harvest that? It can be something that occurs naturally, like I showed you. It can be something that we can create in our own clinic or in our own laboratory. There are many reasons that we use plasma today, not only on the examples that I told you and that I'm going to give you now, but many others. The device, it's like this. We harvest the energy of plasma like this. First, we put electric current to the tip of the machine. Then it makes the gas, which is the air between the tip of the machine and the skin, plasma. So you have a little tiny lightning bulb there. And you can apply that in the shape of a shot like this, or you can apply it in the shape of a plasma shower, which is something that I will explain to you. There is no shock. There is no shot like this. You don't feel any shock too. But still you have the ionization effect that will help you with some things that I'll tell you later that has to do with cell transportation. Now, what is the effect of plasma in the skin? First, superficially, you have the skin surface. Then, when you apply plasma in the skin surface, you kill the bacteria by breaking the bacterial molecular structure. So, that's amazing by itself. I love to use it. By the way, Dr. Vafa Kaliova uses it for that too, and it was one of the reasons that we got together, because we are both passionate about plasma, for killing the P. acnes. Yes, my assistants even, they come with a pimple. I said, come here, I just do a little shot. Next day, no pimple, because I just killed the P. acnes by this very simple thing. There is no antibiotics, there is nothing. They only feel a little, done. It's amazing. Then, on the epidermis, when I go a little deeper, it dramatically increases the skin absorption rate by temporarily breaking the cell's adhesion molecules. And that is the plasma shower. When you go a little deeper, you can generate collagen production and remodulate of dermal architecture, because we can ablate, we can sublimate, and we can heat. You have the thermal heating, that is the one that aggregates all the fibroblasts and all the cells that we want for regeneration. The beauty of it, when I talked about thermal heating, everyone comes to me, Gina, but CO2 fractional laser does that too. I already have that machine. Why should I use plasma? Because of this. Here is the sublimation with the plasma, the zone of thermal damage. Then we have the zone of thermal modification. All around this area, around this zone, you are not giving sublimation, ablation damage, you are giving only heat. And this heat will create accumulation of fibroblasts, and that's exactly what we want. Immediately, we have actually two big effects. The first one on the skin, when you do the ablation, you have immediate tissue contraction because of the denaturation of the proteins. Then you have the thermal disruption, which is this. We also have in the thermal modification zone, the only heated area, not ablation area, we have the cascade of neocollagenesis. So you are producing what? Collagen, elastin, fibrin, in a way that I have full control of. But, and that is the problem, when you have the CO2 laser, by the way, I am not talking against CO2 laser, I love it. And like Dr. Battistella said and Dr. Blunt, I use it a lot for vaginal tightening. I'm in love with Mona Lisa. It's a machine for genital tightening with CO2 laser. So I'm not talking about against the CO2 laser, I love it. I'm just saying that when you want to work on the skin and be detailed, this machine is a little bit more appropriate, in my opinion. So when you give the CO2 shot, you have a much bigger zone of thermal modification, and that creates damage. That's my entire point with this slide. This next slide, I want to talk about a second use of the plaque spot that I'm also very happy, because I just went to Rome the other day, and we were in this congress, and I just saw another doctor, Dr. Beatriz, talking about a usage that I never saw anyone talking about, and I was already using here. So we had this whole, we are together in this talk, but it's something that you are going to see more and more and more and more. It's the transdermal drug delivery by plasmaporation. What we do is that this test done by the Korean Institute of Skin and Science, Clinical Sciences, they put topically vitamin B3 on a patient's skin, and they did plasma on one group and did nothing on another group, and they measured the amount of absorption in the skin. You see here, this is the control group, no change, because these are minutes, okay? No change, and then you have here, when you get to around 1 hour, the peak of absorption, and you can see it's obvious the difference. So you have absorption underneath the skin. This is the plasma-treated skin line, and this is the plasma-untreated skin line. Now I'm going to tell you, I want to give you also another example of this. I do something that, it was what I found the other doctor doing, Dr. Beatriz doing in Rome. Both of us started with this mind that, okay, drug delivery. Then a patient, I have many patients that come with problems of fillers and Botox to fix it. And I start doing, after a Botox or a pitosis because of a Botox, I start doing plasma because of the heat, the thermal heat, which would help making the Botox finish fast. But then I start doing it for Tyndall effect. Tyndall effect is the problem when the filler, especially on the under eyelid, on the tear trough, is put it too superficially. But I got really sad because I didn't want to melt completely that treatment that my patient, expensive treatment for some of them that they did. I just wanted to take out the extra amount, what was overdone. So I start dropping a little bit of hyaluronidase, and I do massage with plasmaporation, and it was gone. They were happy. There was no injections, no swallowing, nothing. And they were able to keep the filler that they already did. I just took the problem out. The same thing I do after surgeries. I don't know if you know, I work with Dr. Bülent, so we are a surgical center, and we have a lot of patients coming after spider web and these things, but they want to go back to their lives, but they are swallow or they have purple. What I do, I put simple arnica gel on the skin. I taught my assistants to do a little bit of lymph drainage massage, and they do that with the plasma pot. Right away, the patients, they see the difference. They get less swallow. They come out saying, oh, I'm feeling much better. That feeling of fullness that was giving me a headache is gone. So it's something that I am very happy, and I'm using more and more and finding every day new reasons and new ways to use this capability of this machine. Some applications, skin tightening, scars, even hypertrophic scars, skin resurfacing, benign skin lesions, and transdermal drug delivery. Many non-invasive treatments to rejuvenate the skin are characterized by an unattainable balance between effectiveness and morbidity. But plasma, because we can control the result, we can control the side effects, is not only very versatile, but it's always very simple and very safe for you. So it's not about how much you make, how many you make, it's about how good you use your time to make it. So if you make little, but you make without giving you headaches for you or your patients, I think that's the best way to go. And that's why I advise, I am very happy with plasma. Now, I'm going to start doing a procedure. It's not going to be too long, but if you have any questions, I'm going to have my dear friend, Dr. Renata, helping me out. Okay?
Ben bir şey soracağım.
Buyurun.
Bu skarlarda kullandığınız zaman bunda bir seans sayısı verebiliyor musunuz? Bir de keloid oluşan skarda sonuç nedir?
Evet. Bu çok iyi bir soru. She asked me if I use it for hypertrophic scar, keloid scars, and if I do... Sonra ne dediniz? İkinci yolu.
Keloid'de nasıl
Aha.
sonuç? Bir de normal skarlarda belli bir seans sayısı verebiliyor.
Okay, and how many sessions I use it? There are, two types of scars, the hypertrophic ones and the hypotrophic ones. For the hypotrophic ones, it's very simple. You just put it in the middle, the shots in the middle, and it will recreate more collagen. So simple. And it tightens also the edges of the scar, so it goes in and out. So that's great. I use it for acne scars. Dr. Vafa has an amazing work about acne scars with plasma. And the hypertrophic one, if it is keloid, you have to look around to see if the patient it was a one-time keloid thing because he did something in that scar, or if he has genetically the possibility of keloid. If that is happening, then you should not touch, because keloid, sometimes even with a pimple, it comes out. You should be very careful. But if it's not, if it's something that happened because of a surgery that had too much traction in the suture, or because he used some kind of... The camera, yes. Or because they used some kind of... Some kind of products there, and it became a keloid, then yes, you can. And then you are going to do different. You are going to use the ablation to take out that tissue. So you ablate, you are going to see it going down, and you take out. And the same thought and the same mind you are going to use for skin lesions too. The machine can actually, you can choose that. There are many types of machine that you can choose that.
So you have another question there?
Yes. Dr. Gina,
Yes.
what about post-inflammatory pigmentation? Is it a common side effect?
Yes, it is, but this is all about, just like fractional laser, you choosing your patients. Whenever I have a Fitzpatrick 3 or more, it's more safe than fractional laser, but I always do a test, and I wait 2 weeks. Either if it's on the face, I do in 2 points. I do behind the ear and I do under the chin. If it's on the body, I do right next to the lesion if it's not an area that they are worried about, and try it to see. I tell them how to take care of it. They should be very careful with sun exposure, with heat. I have a whole thing that I give them to take care. But in the truth, yes, it can happen. But again, like any other energy-based device, that can happen. And if it does, I normally, even after I did all of that, it happened, I normally treat with cream. I go very high on the arbutin. Yeah, vitamin, or arbutin or kojic acid, depending. And if they are very sensitive skin, I mix also with B12, a cream of B12 and hyaluronic acid to calm down the skin, but still I keep it. And I do it for 2 times a day for 3 weeks minimum. I can also do that for prevention, if I want to prevent that to happening. A chair?
Okay, so now we're going to start.
Sandália.
And Dr. Gina will show us
Sandália.
how her special techniques for plasma.
Yok, mikrofonu sorun çıkar. Kullanmayacağım bunu. Şimdi değil. Tamam, teşekkür ederim. Işık burası koyabilir miyiz? Biraz daha yakın olsun. Biraz.
So she will start. So Dr.
Okay,
Gina,
biraz daha.
do you make any numb
Okay, yeter.
before this?
Yes, that's very important. We use a numb that is 10.56 percentage of lidocaine. She stayed with it for around 1 hour, but for upper eyelid and lower eyelid, if you mark it before, because it's very important, the anatomical stretching of the skin, then you can do it with also local anesthetic.
Okay.
Can you look there for me? Yes. Okay, I have to turn it on. It's very easy to choose the settings of the machine. I'm choosing now continuous shot with level 1 because the skin is very sensitive and very thin.
So you're doing for this crown fit, yeah?
Yes, I'm doing for the tightening. I actually want to show her. Can you zoom in here? Yes. The patient is complaining for me about the elasticity of the under eye lid skin and the little wrinkles there. I cannot treat those wrinkles with Botox because of the fear of the sclera show side effect, which when you put Botox around the orbicularis oculis too much, too close, you can have the sclera show, the white show. So I treat her with the upper eyelid already. I took all these crow's feet here. I treated her before for upper eyelid with the plasma pot. Now she liked it and she wants to treat the lower eyelid. So that's what we are doing here today. I am going to give less than a second of touching. I don't touch the skin, as you can see.
So you always do this in a continuous way, like
Yes.
you're doing.
The important thing is that I cannot give any pattern to these little tiny shots. I have to do it a little bit. You see, I do it without giving a special pattern to it. Can you all see it? No. Okay. Now. Burası. There you go. Can you see? I am trying to put not any pattern. And there is one important thing I'm going to show you. Do you see the wrinkles? Can you see the wrinkles when I do this? Look. I cannot give inside the wrinkles. I should give outside of the wrinkles because of the tightening effect, so it will pull out and bring it up. I should never give it inside the wrinkle, or else I'm going to make the wrinkle even deeper.
So you do both sides of the wrinkle, up and
Yes,
upper?
look,
Okay.
I'm going to do here. Can everyone see? I'm doing the edge of the wrinkle, and then I'm going to do the upper edge of the wrinkle. That's it.
And there is any problem if you go again at the same place you did?
You should not. It's always one pass. Because or else I'm going to go deeper. I'm going to change the layer of the skin that I'm trying to treat. The scabs should always stay unless you are treating something like a hypertrophic scar or a skin lesion. Then you need to clean the scabs out. But in this case, you should not clean the scabs out. You should leave, and she cannot take them out also. It has to fall off on its own. Because the scabs, they are acting like a natural dressing, organic dressing. Preventing, because I killed all the bacteria, like we talked. Now I'm carbonizing the skin, so leave the carbonized skin there, because it's a dressing. And that is what gives a really good recovery time. On the first 10 days, she had a little bit, this patient, because she's Fitzpatrick, like I would say 3.5. But she had a little bit of redness, but you can see now in her top eye, it's completely gone. She has nothing. And then I go in between the lines. It's very fast. You can see, if I do it very closely, if you come very, very close, look, I'm going to do like this, the 5-point technique. And then if you come really close, you can actually see the skin tightening. Did you see? Look. You can actually see the skin tightening around it. Renata, can you see here?
Yeah,
Take a look.
Yeah, I can see.
Look, I'm going to do in this skin that it's very
immediately,
soft.
yeah.
Okay, I do. Now you're going to see the points getting together. Did you see?
Yeah.
Yeah.
Which is the distance you give to each point for another
It depends
one?
on how strong I want to be. Like I said, you can choose everything. I can do like this and have a very fast recovery time, and I can do like this and have more effect, but the recovery time is going to be longer.
Maybe for deeper?
Yes, yes. And the more time that I stay, the deeper it goes. Also, I have the changings here. I am now in the first number 1. I can go to 2 and to 3. I'm going to do this side too. Can you see? Can everyone see here?
So it's really safe to do it next to eyes. There's no problem?
No problem. The only thing that I advise, especially for the beginners, is to never do on top of the eyeball. Pull the skin up and do it. Don't do this. Because if you make a mistake, you stay longer, then you can go too deep. But still, the chance of really hurting the eye is next to none. But we want to be safe anyways.
And is there any problem if the patient is sun-tanned?
Yes, I should never do anything on people that have any kind of extra movement, extra metabolism of the melanocytes. You know that better than I do. But once if they are a good candidate for this, and they lost their bronze, it's no problem. Okay, this side we are done.
Perfect.
Incidence.
Yeah, it's really good. I can
Okay.
see here it's...
You can see how it tightens. Look at that. The skin is already, can you check? Can you see? The other one. Oburu gösterir misiniz? Obur gözü. Do you see? The folds? On the other side, the folds are gone. Now she's going to start swallow a little bit. There it is. There it is. This will stay, this effect. She will swallow a little bit later. She's already starting to get red. And if she has the need to one more procedure, I would at least wait 6 weeks. Unless I do something very superficial, then I can do it again. She will recover before that, but because she has the chance of hyperpigmentation, I would wait a little bit. And no sun for her.
Okay. Remind, sun protection again.
Okay. I will do the other side outside of the camera, so you can have a little rest before Dr. Peter and Dr. Bulent start. But if you have any questions, I'll be here. Thank you. Thank you for watching me.
Thank you.